Hi, everyone. Thank you for being here today to discuss advanced care planning. Um, and thanks for the invite from the Hospital Foundation. I'm very happy to be here. So what I'm going to be discussing today is what exactly is an advanced care plan and how do we go about making it. So of note, I have no disclosures for this presentation. So an advanced care plan, also known as an ACP, is a roadmap you make and share with your loved ones and healthcare team. It outlines what kind of healthcare is acceptable to you, especially if you cannot speak to yourself, for yourself. It's also a gift to yourself, a gift of empowerment as you've taken the time and put in the effort to really think about what's important to you and what you want from your medical care, and something that ensures your voice is never lost, but instead is always leading your medical care. It is also a gift to the people you love. It ensures that your wishes are clearly laid out and no one is guessing about what kind of medical care you would want. This is especially important as loved ones often have to make critical decisions on your behalf during very emotionally stressful situations. And it is so nice for them to know these decisions were already made by you, and all they have to do is share those wishes with the healthcare team. Over the next few slides, I'm going to outline the process involved in making this advanced care plan roadmap. So in order to make an advanced care plan, you need to start with thinking about your life in the coming weeks, the coming months, years. What does quality of life mean to you? What brings you joy? What makes life worth living? How do you want to spend your time? What are your priorities? What are your worries when it comes to your future health or death? And what are you willing to go through to prolong your life? What abilities are so crucial to your everyday life that you can't imagine living without them? To answer some of the questions that I just mentioned, you might need more information about your health. So the next step in making an advanced care plan is learning. You need to learn about your current health conditions, what type of treatments or procedures or complications could arise now and in the future as your condition changes. What kind of support will you need to cope? Will you need a caregiver? Will you need home care or home support nurses or other healthcare professionals? Will you need equipment to help you stay mobile and safe? Can you be cared for in the community, which can be at home or going to the clinic for appointments, or will you need to go to the hospital? If you are unsure about how to answer questions about your health, it's a great opportunity to meet with your healthcare provider to get the information and insight that you need to answer the questions I mentioned before. So now it's time to reflect. You want to reflect on step 1 and step 2. So step 1 being thinking, step 2 learning. What healthcare options being offered to treat your condition align with your goals, with your values, your priorities? So this exercise of reflection can really help you to determine what medical care options are best for you. The next step is deciding who you trust the most to make your medical decisions on your behalf if you cannot speak for yourself. It is important that you let this person know that you would like them to take this role and make sure that they are agreeable. And just of note, in BC, if you have not chosen a decision maker, one will be chosen for you. And this is based on a very specific criteria, which I've laid out here. Sorry, am I not on the slide? It's not on the slide, but I'll just go through it with you here. So the first on this hierarchical list of decision makers, the decision would go to your spouse. So you can be married, you can be common law, and the length of time you're living together doesn't matter. But that's the first person that a healthcare decision would go to if you haven't chosen a decision maker. Next in line would be a son or daughter who's 19 or older. Birth order doesn't matter. Next in line would be a parent, biological, adoptive, or guardian. Next in line, a brother or sister. Again, birth order wouldn't matter. Next in line, it would go to your grandparent. Next, a grandchild. Next, anyone else related to you by birth or adoption. After that, it would be a close friend. After that, a person immediately related to you by marriage, so things like in-laws, step-parents, step-children, and last of all, someone who's appointed by the public guardian trustee. So if people on that list don't fall into the people that you would trust the most to make your medical decisions, you can see how important it would be to choose someone by yourself. Okay. So the next step for making an advanced care plan is talk. Discuss your wishes with your loved one, with your chosen medical decision maker, and your healthcare team. All right, last step in making an advanced care plan, document your wishes. There are a number of resources to help to document your wishes. So various forms that you can help to do this, like an advanced care directive, representation agreements, do not resuscitate, also called the DNR. And our next speaker, Carmen, is going to go into more detail about some of those. And I have to say that the best resource for completing an advanced care plan is the Green Sleeve program out of Coast Hospice. So they actually have a table out in the lobby today. If you haven't visited it yet, definitely go on your way out. And they can address any questions you might have. They also run workshops about advanced care planning throughout the year. They have a dedicated advanced care planning website, and they can also arrange for a one-to-one volunteer to come to you to help you make your advanced care plan and get through the whole process. So I think that's a pretty incredible program that we have right here on the coast. And we're so lucky to have such a dedicated group to support advanced care planning here. All right, so for the final review, these are the steps to make an advanced care plan. You, number one, want to think about your values, wishes, beliefs. Number two, you want to learn about your medical condition. Number three, you want to decide who would be best to make medical decisions on your behalf if you couldn't speak for yourself. Number four, talk to your loved ones, your decision maker, your healthcare team about your wishes. And number five, document your wishes on the appropriate forms. So that's all I have to say right now. Thank you so much. And we'll get Carmen to come up.